time to take mental health seriously. There was a 1,000+% increase in mental distress in the US compared to last year. During the COVID-19 pandemic, social isolation has caused a shortage of mental health care. This is because there is a major increase in psychological and social effects like anxiety, chronic stress, economic difficulties, and substance use and abuse, affecting the general population and healthcare professionals. The most affected people are individuals with pre-existing psychiatric disorders and people who reside in areas with high COVID-19 presence. These stress-related conditions are closely associated with suicidal behaviors, which have been on the rise, and crime rates such as partner violence, serious batteries, and homicides, which have increased due to the mandatory lockdown orders.
Due to the enforced lockdown, people have started to feel more isolated. This has led to an increase in the worsening of pre-existing conditions, the creation of mental illness, as well as an increase of poor coping methods. A study showed that 46% of students were so depressed they found it difficult to function. Another study showed that 16% had seriously considered suicide. The development of mental illness has been significant. 1 in 8 COVID patients have developed mental illness, as well as 27% of post-secondary students were more likely than the general population, thus leading to poor coping methods. For example, there has been an increase of binge vaping in Montreal, as well as 44% of people say they increased their alcohol consumption due to this increased stress.
The current pandemic has had a particularly severe effect on all healthcare workers. They have had constant exposure to the virus and its outcomes, affecting their mental health. Studies are showing healthcare workers have suffered high levels of depression, anxiety, insomnia, and distress. In a study done with 230 healthcare workers, 53 had psychosocial problems. Another survey of 1,257 healthcare workers found 72% had experienced symptoms of distress. On January 10, 2021, a doctor in Montreal committed suicide, said to be because of the stress of the current pandemic. Their family spoke up about how the healthcare workers were not getting the support they needed. We are not done with this pandemic yet, but we need to better support the healthcare workers along the way and after.
Despite the rise in mental illness, these organizations and mental health clinics are still massively underfunded. Due to the influx of new patients, the health workers and doctors have been unable to deal with the influx of them, and so they're starting to shut down. 60% of mental health clinics will run out of funding in less than 3 months. In order to give a better explanation of this, the US government usually gives out funding to the governing body of mental health, which then gives money to the states, and this organization received less than 1% of the required funding from the US government. This, along with the lack of donations, is causing many of these organizations to be able to constrict and then eventually run out of money. Another problem is that in rural locations, Americans are dying twice as often as COVID versus urban locations. As well, there's fewer social workers and doctors in these rural locations, which is compounding the effects of the lack of funding there for mental health.
Mental health disorders disproportionately affect the most disadvantaged. However, access to mental health care services is becoming increasingly costly and inaccessible. While 5.3 million Canadians reported needing mental health help, 2.3 million reported having these needs unmet or only partially met. Nearly 30% of people with emotional disabilities live with low income. Insurance coverage for mental health services is also rare and limited. Insurance typically only covers 2 to 8 visits on average and does not include all services, causing patients to pay out of pocket. While lower cost alternatives such as BetterHelp and free hotlines are available, these services are flawed. Mental health hotlines do not provide people with personalized long-term care and are not sufficient for treating mental illness. Meanwhile, services such as BetterHelp typically cost $60 to $90 per week and do not offer in-person visits or prescriptions. Despite these serious systemic issues, it may be possible to create a system that addresses underfunding and improves access to treatment. What if we had a system where the most disadvantaged received accessible care and where those with the means to help had the ability to do so? Thank you.